thank you for having us. We will do our best to be concise, but as you can imagine, the VA system is a huge system. So there's a lot of information that you can see in your packet. And so we'll do our best to kind of keep it streamlined the best we can. So let's do it. That button didn't, but maybe another button will.
Maureen, are you advancing or us?
You are, I don't have control.
I don't, it's not advancing.
Down the bottom where it says slide 2.
Ooh, all right.
There you go.
Touchscreen.
All right, we're going to boop it. So these are our objectives today. We're going to talk a little bit about VA eligibility to give you a little overview about if you're talking with a veteran, you are a veteran, you know a veteran, what some eligibility might be to get VA healthcare. We'll talk about some VA healthcare programs and a little bit about Veterans Benefit Administration, which is another agency within VA services. All right, why not? We're just coming out of winter. You got to have a little bit of a fun slide here, so let's do it. All right, so I'd like to show this slide to help understand the structure of the Department of Veterans Affairs. So if you're new to the Department of Veterans Affairs, I think this does a nice job to kind of give you a picture to lay it out, that there are 3 agencies that make up the Department of Veterans Affairs. So we have the Veterans Benefits Administration, the Veterans Health Administration, and the National Cemetery Administration. Those 3 agencies funnel up into what you might hear Department of Veterans Affairs or VA. So if you hear VA, that's really like this big umbrella of these 3 agencies. So Sarah and I work for the middle, the Veterans Health Administration. Anything that has to do with medical care, getting somebody, anything to do with their health, that's what we do. The Veterans Benefit Administration that we'll talk a little bit more about is to do with the money. So we get confused, or people get confused a lot between those 2 agencies. We work together routinely, but we are 2 separate agencies. Our systems don't talk to one another, and we'll kind of tell you why that's important. But we're going to focus the first part of this presentation just about the healthcare side of things. So first, let's talk about eligibility for healthcare. So if you are talking with a veteran and you're not sure if you should have them think about if they're eligible for healthcare, these are some things that you want to think about. There is a time in service criteria for healthcare. So I won't read through every single thing on this slide, but really the important pieces are, when did somebody serve in the military? Because there are time frames around it. So if you enlisted before 1980, there's a criteria of how long you were in the military, 24 consecutive months. If after, I'm sorry, I just backwards that. Sorry, if you're in after 1980, 24 consecutive months. Before that, there's a different criteria. So you have this minimum duty time that you're in the military. This is only for active duty. Right? So National Guard, you'll see this bullet on the bottom here, is a little bit different. If you're in the National Guard or Reserves, you have to be called to active service in order to qualify for VA healthcare. All right. There is other criteria that goes along with this. So there are sometimes other things, right? If you were, I'm just going to pick a few, former prisoner of war, received certain medals, were in certain places at certain times. This kicks you into other eligibility status. Okay. We also have a description of, it's not on this slide, it was in our previous slide, of a disposition of when you get out, an honorable discharge. So you have to have anything other than dishonorable. So time in service, anything other than dishonorable. And then there's all these other little caveats that might make someone eligible for healthcare. So because there's all these little pieces that go into it, we always say to every person that has served in the military, let us take a look at your specific situation and let us make a determination based on you and your situation, where you served, when you served, how long you were in the military. And let us make that decision based on you and your specifics, because all of that is hard to put your specifics into. If none of kind of those general things, or if you fit into some of those things, there's also an income criteria that we do have to look at. So sometimes if you've heard a veteran say, oh, I don't meet the income criteria, that is a thing. In this slide, if you get it electronically, there is a link that you can click on to see what the income limits are. It is based on geographic area, so it does vary based on where people live. So to say all of this, a lot of people who served in the military are eligible for VA healthcare, but not everyone is. All right. If somebody isn't, we try really hard to make them eligible. Somebody is service connected, so they have an injury or illness related to their service. None of what we just talked about matters because somebody is eligible. It doesn't matter if you're a billionaire. It doesn't matter if you were in for 3 days. If you were injured, you have an illness related to your service, you're going to be eligible. So again, lots of different ways that you can be eligible for healthcare. So every individual person should talk to somebody at the VA, because we can see based on your situation what we can do to try and get you in for healthcare. So the next slide talks about how to do this. These are the ways that somebody can apply to see if they're eligible. All right, so we're going to kind of from here go based on the idea we're talking with somebody who is eligible for healthcare. All right, if somebody is not eligible for healthcare, the services that we'll talk about, they don't apply to somebody who's not eligible for healthcare, except you'll hear about the Compact Act, which is a little bit different later on. So somebody's enrolled, what is next? So you're eligible for VA healthcare, you received the letter, you're enrolled, you're eligible for VA healthcare. What happens next? Every veteran is assigned to what we call a priority group. We have 8 priority groups, 1 through 8, and they are based on multiple factors. Very, very tiny. Take your time, blow that up, or go to the link that's in the slide because you can see a little bit more detail in this link. But our priority group number 1 are our veterans who have, I mentioned service connection. Talk a little bit more about that when we get to the Veterans Benefits Administration, but those are those injuries or illnesses related to your military service. So our veterans who are 50% to 100%, that's those veterans. Unemployability, and then you can see there's all different criteria all the way down to 8. So priority group 8 is somebody who has an income above VA limits and might have a copay, or will have a copay, I should say, for services. And there's a lot of different things in between there. So once eligible, you're placed into a priority group, and your priority group will tell you what benefits within healthcare you would be eligible for. Okay. All right. So this is the general healthcare benefits package. So once you're determined to be eligible, this is what you get. This is what you get regardless, everybody who's enrolled, regardless of your priority group, is going to get preventative services, inpatient, outpatient diagnostic treatment, prescription services. Now, some priority groups do have copays, right? So that was in the priority group list there. So that could be something to consider, but everyone does qualify for those services once you're enrolled in VA healthcare. Benefits with special eligibility criteria are here on the bottom of the slide. So ambulance services are based on clinical need. Dental services, I have a slide on dental services. Non-VA care, we have some follow-up slides on that. Eyeglasses and hearing aids, that's priority group 5 and above. Prosthetics is based on what your clinical needs might be, and certain counseling services. So you'll see that's Compact Act and some of the services that we have. So to pull one of those out, one that we get a lot of questions about is dental. So I'm a veteran, I'm enrolled in the VA care. Do I qualify for dental services? This is the criteria to qualify for VA dental care. So there are certain criteria for dental services at the VA. A lot of VAs have dental care right within the VA. We also pay for VA dental care in the community. It just depends on your VA. But not every veteran will qualify for dental care. Right, so those are kind of general, every VA services. Once you're enrolled in VA healthcare, general services that anyone would qualify for. This next slide is about the Compact Act. Again, this is thinking about all VA services across the country. This is something new as of January, and it relates to our veterans who might be suicidal. So it's new in the sense that it's an expanded service. So we've always provided care to any veteran who is experiencing acute suicidal needs. But now we're expanding that to veterans who would not be enrolled in VA care. So you can see with this new PACT Act, we're providing treatment that covers the cost of transportation, inpatient, crisis residential care for up to 30 days, outpatient care up to 90 days to include social work services. So this is an expanded service, and this just gets a little bit more into the eligibility for this. So it could be someone who's not eligible for VA or not yet enrolled that we would still pay for this service for. Another change that just came out in April, actually hot off the press. So April 4th, there's now copay waivers for American Indian and Alaskan Native veterans. So we will be looking, the VA will be looking at a process to go through and get official documentation for veterans in this situation. So they're asking that on all the documentation where veterans are applying for VA services, there is a checkbox where you can indicate if this applies to you, and asking veterans to make sure that they check that off, because this could impact copay status if that's something that a veteran would have otherwise. So copy of official tribal documentation showing that they're eligible for this waiver, and copays could be taken away. There is also going back a little ways, it looks like January 5th is what I understand that to be, but this is kind of new and rolling out, so I'm not really sure how that's going to look. All right, so that was intended to kind of give you a bigger picture, overall arching VA eligibility, some bigger picture services. So we wanted to talk a little bit about now our more local Manchester, New Hampshire VA services, with the intent that most VAs across the country have these services, but they might fluctuate a little bit in terms of eligibility or how they provide those services. So I will turn this part over to Sarah.
Oh, all right. So just press the button.
Yeah, just,
Clearly it likes me.
oh, you gotta press this one.
Oh,
There you go.
fine. All right. So this is our main campus in Manchester. So some of you all may know we're up on Smith Road. So this is where a lot of our main medical services are. So we have primary care here, our urgent care is here. A lot of our specialty care is here as well. So it's our, like we say, main campus. This is where a lot of our stuff are. So a lot of veterans start here. And then we also have our C-Box, which we are our community-based outpatient clinics. So you may hear C-Box. That is what we all call them. We have lots of acronyms here in the VA, as you may or may not know. But we have 4 of them right now. So we have one in Portsmouth, which is on P's base. We have one in Tilton, which we are going to be moving, I hear. So we're in the process. So that's going to be exciting. We're going to have a bigger place. one in Conway and one in Somersworth, which is our newest one, Somersworth. It's an expanded one. It's very close to where it used to be. It's kind of like across the lot, but a nice big place there as well. So these all facilities have primary care in them. Some specialty, like Somersworth is our bigger facility, so that we have a lot more specialty going in there, but we do have some specialty that are going into all of our CBOCs on a rotating schedule. So we try to make sure that we can be able to provide the same level of service or as close as we can into our main campus. And so this is just a list of services that we provide. So just I won't go through all of them, but some of the bigger ones is our preventative medical care. So primary care and home-based primary care, which is the HBPC. That's where you can get primary care right in the home. So the veteran can stay there, be at home, and we can get a primary care provider, nursing, social worker, OT, and a psychologist that will all come out to the home to provide that service. So these are really for our homebound veterans that have a difficult time getting in. And then we have our urgent care, which is open Monday through Sunday, 8 to 4:30, excluding federal holidays. So we are not open during those times. And we have our, as I said, outpatient medical specialties. So that could be like cardiology, pulmonology. So pretty much anything that you would see, we have in-house right in Manchester. And pharmacy, prosthetics. So I think I go through a little bit, couple more things on here. All right, so the social work driven programs. We're very lucky at the VA. We have a lot of social workers and we have a lot of social work programs. So it's very exciting. These are great to be able to help support our veterans through any kind of part of life that they're in. So we have a lot of programs for our younger vets, that's our M2VA. So these are our vets that are discharging from the military, so we can help provide comprehensive service and support for them. And then we have stuff for, our older population. So our adult day health, which I know Lori kind of mentioned a couple of them we contract with. So several other programs, which we're going to be able to talk about as well. We have a lot of homeless programs to try to help support our vets, which we also work very closely with you guys as well, to try to provide, to help support our veterans and regardless of whatever is going on with them. So here's just a pretty comprehensive list, but they're pretty big programs. Also, our Women's Veterans Program, which is, so we have a program specifically for our women veterans if they want to go through primary care through specifically for women. So it provides a whole continuum of care, as you can see on here. So they have primary care, mental health, disease prevention, screening, emergency care, specialty care. And the VA now provides more reproductive health services under the interim final rule, which is a newer rule. So, so even expanding even more for that. So we have a social worker there, we have a program manager, so and lots of support to try to help our women veterans and through this process. All right, so our caregiver support program. So we have two sides of caregiver support. We have what we call our comprehensive, well, actually we start with the general, so we'll start with the general. So our general caregiver support program, and that is to help any veteran of any enrolled veteran, and to try to help the caregivers. So the caregiver is the person that is going to be providing personal care services to our veteran. The program is very specific for the caregiver of a veteran. So it's not for veterans that are caregivers, which I know that is a question we do get. Not that we can't try to provide support and give resources and things, but these programs are very specific for the veteran being the person needing care for them and to support the caregiver. So our general program, it doesn't really have much of a qualifier other than that the veteran needs assistance with personal care and they have a caregiver that's providing those assistance, but they're able to provide a lot of support to them. So we have support groups, we have lots of different educational groups. We also have a caregiver support line. We have peer support, lots of self-care courses that we have. So it's a really great program. So regardless, so you don't have to be a certain service connection or anything to be able to access this program. And then the second half of our program, this is the comprehensive. So this is the other half, but does have very specific qualifications for this program, but it is now open to all errors. That just started this year in October. So now we're open to all errors, but they do have to meet clinical eligibility. So they have to have a 70% service connection or higher for this program. And again, need to have a caregiver that is providing support for their ADL needs. So it's very strict criteria. This is a program that you have to apply for. And if they apply for it, it goes through this whole process, get an assessment, our team goes out and then they're reviewed for eligibility. And if they are eligible, the caregiver can get a stipend to pay. They get paid basically to be the caregiver for the veteran. There's 2 different levels of the stipend. So that's dependent on how much care they need to provide to the veteran. And so then this is the other things they're able to get, including, so we have the financial stipend, access to CHAMP healthcare insurance if they're uninsured, mental health counseling. So they're also able to access part of the other general part, which have our caregiver education training. They're also eligible for some respite services. So that could be in the home or in one of our facilities that we have a contract with. They also can receive this Hero Miles, which is, we don't use it very often, but if we need to travel someone to a place to be able to care for somebody, we have the access to that. So they're able to get eligible for a lot of things to help support our caregivers who are supporting our veterans. So it's a great program.
How does someone apply for that?
Sure. Yeah. So there's 2 ways you can do it. There is a paper application. So actually, if you go right on, if I can go back, I don't know how to get back, but in the bottom, there was a link on there. So if you go in, if you have it, there's a link right there. And you can get access to the paper application or you can apply online. So there's 2 ways to do it. And then it goes right to our caregiver support team who will outreach the veteran and the caregiver to schedule a time to go out to their home to do a full assessment. So it's usually a 90-day, we have 90 days to basically do the whole assessment. So, and then once they get eligible, then they'll be welcomed on the team and then they have much more support for the program. So it's a really good program. Any more questions? Did that answer your question? Okay, perfect. All right, so home health aid. So I think you probably all know what a home health aid is. So we have a homemaker home health aid program that eligible veterans, so they have to meet criteria for the program. So there is an assessment of their ADLs and IADLs and their medical diagnoses. And if they're eligible, they're able to get a homemaker or a home health aide to come out to their home to provide support to them. It is like you have to meet the eligibility criteria. So not just anybody can get it. So they have to have a full assessment through their primary care providers and the staff in there. And then we work with local agencies that we have contracts with to be able to provide those services. So in the range of hours, it's a full range of hours. So depending on the need. And we also sometimes too is we'll have somebody that can maybe come in at a lower range, but then they need more support as they age and as their, things are going on with them. We can reassess them and to hopefully increase services as well to help them. Oh, sorry. Yes, thank you. I did not do that earlier. Does a home health aide provide transportation? It's dependent on the agency. So there's lots of rules around it. So not always. It's not the best answer, but it's not always is able to do that. All right. So adult day care. So the adult day health care. So as I mentioned earlier, we do have a couple that we do contract that right here for Easter Seals, but it's a program that veterans can go to during the day for social activities, peer support, companionship, recreation. We have several of them throughout the state that we're able to help support our veterans getting to. It's similar to the homemaker home health aid where it is an assessment based on their ADL needs. So they have to meet that criteria to be eligible for the program. And if they're eligible, then we work with one of our local agencies that we have contracts with. We usually have them go for a trial day to make sure it's a good fit. And then we work with them to make sure we are able to provide transportation for that in some cases if they medically need the transportation and the facility has a transportation. So we work with them on that. But there is could be a copay depending on what their service connection is, kind of that eligibility criteria. But there is a way that we could possibly waive it. So if we try to work with them to be able to get to apply so that they can get financial assistance to pay for the copay, because we don't want to have a barrier for people to be able to get these services. All right. Veteran directed care. So this program is very similar in needing to have the similar eligibility where you need to do an assessment to determine if you're eligible. This is a much higher level of eligibility, so you need to have 7 ADLs. This is a program really meant for our veterans that are nursing home eligible. Like these are our veterans that if they did not have this support would probably end up in a nursing home. And what this is veterans are able to hire a caregiver to provide care to them. So if they're eligible, they get a budget based on their needs, and then they have to hire their own caregiver. So a lot of times it could be a family member, it could be a spouse, it could be a neighbor, but if they don't have somebody particular, like we can work with them to try to put an ad in to have a caregiver. It cannot be agency. So this program is very different in that way. Like we can't work with a specific agency and then pay that agency. It's very specific about a caregiver. But they are able to provide a significant amount of time in the home to help support our veterans. So it's a really great program. And as long as they meet the needs, then they can get a lot of support in the home, and they're eligible for some other additional finances, so that some people will be able to have some funds to purchase additional supports in the home or respite or different things. So it's a really great program as well. And that is the eligibility, very similar. If they're interested in it, it goes through their primary care who can do the assessment to determine if they're eligible. So our community living center, so you'll hear the word CLC, we use that all the time. So this is a like a rehab center right in Manchester, right in our facility. So there are CLCs throughout the VAs. Not every VA has a CLC, but every CLC at a VA is run very differently and has different criteria. You will hear the term one VA is one VA because it's very true. So what one VA has and how their criteria in certain programs are is not necessarily the same on everyone. So, but our CLC, we do have a small CLC where we can take people for short-term rehab as well as for respite. So we are able to offer respite to veterans, and sometimes we can utilize our CLC if we have the availability. And so, and the intent is to be able to help support our veterans in that short term and be able to return them home. So, so it's a great program. And like I said, it's located right on main campus. Right. So our contract nursing homes. So we have right now 7 of them across the facility. Not across the facility, across the state. And you have to be service connected for this. So there's very specific, bless you, very specific service connection for this. So most likely it's 70% service connected or higher. There are some little caveats to that. So if you have somebody that's anywhere near that and you have questions, please feel free to reach out to us. But we have contracts with, like I said, 7. So if somebody does need long-term care, they're able to go into one of our contracted nursing facilities for long-term, and they do not have to pay for that service. That is a benefit of them for being a veteran with that service connection. So there's no cost to them. We also can provide short-term rehab services, hospice, and palliative care for end of life, and special care for dementia as well. You have to meet the criteria of needing a nursing home. So we can't just place somebody because, it's a great idea for the family. They have to meet eligibility for it. And so they have to meet nursing home eligible, and then they have to meet the criteria for that. And I think I kind of already said some of these. But yeah, so just basically if we don't meet the criteria requirements, there's no real way around that. So we're not able to kind of make it work. So, we really encourage people to start talking about and planning for long-term care, as all of you probably know that. But yeah, so, and the other piece that I don't think is on here as well is if we do have somebody that needs hospice care, like very specific needs, like inpatient hospice care, we are able to support them in a contracted nursing facility if they meet that criteria. So they have to meet the medical criteria for hospice. And we can work with one of our contracted facilities to try to get them in for that. And that does not need a service connection. So that's regardless of service connection. So medical foster home. So this is another alternate to nursing home. So these are for our veterans that may require nursing home but prefer a more non-institutional setting with fewer residents. So they're private residents where the caregiver and any relief caregivers, they have a backup caregiver, can provide care and supervision 24 hours, 7 days a week. So this is a program we had prior. We're now getting it up and running again, which is very exciting. So trying to get the word out there as well. But the caregiver provides the help with ADLs, take care of medications, any nursing assistance, all meals, and any planned recreational and social activities. VCP. So this is our veteran community partnerships. Some of you may or may not know of our VCPs or be part of it. So we're always looking for partners. So it's organized partnerships with our local VA to connect with state and local community services and agencies. So we have partners at our VA, and we try to work with our local agencies throughout the state to build really good partnerships to try to help support our veterans within our facility, but also out into the community. So they develop and foster strong relationships, improve access to care. So just really trying to provide that additional support and trying to see how we can make sure we build those really good relationships with our community partners. Care in the community. So New Hampshire, we are special because we do not have a full run hospital. So any veteran in New Hampshire, with the exception of veterans who live within 20 miles of Wright River Junction, are able to access care in the community. So what that is that if veterans, maybe it is too far for them or too hard for them to get to the VA, one of our CBOCs, we can help get them a VA provider, a provider in the community that we contract with, so they can get primary care or specialty care. So we work with them. Being a New Hampshire resident, other than that little caveat, they're able to get eligible for that. That is not every VA. So we do have a really robust care in the community system, and try to really work and try to provide those supports so people can actually get, the care that they get in the VA within the community. And then this is also continuous with care in the community for urgent care. So as I showed you earlier, right, the VA urgent care, we're only open 8 to 4:30, excluding holidays, Monday through Sunday. So if someone needs urgent care outside of those hours, or if it's just really too far for them and they really can't connect, there is a community provider location, so they can go and choose another urgent care that we have a network, so they don't have to come to our VA if it's just inconvenient or it's not within our hours. And also veterans are able to utilize the emergency room as well, and can try to get that phone number right here. So if they call that number within 72 hours, that could also provide coverage for that hospital stay if they need emergent services. We don't want people delaying and coming to urgent care. Unfortunately, that does happen where they think they need to come to urgent care to get it covered, and it's delaying them getting the help they need when they could just go right directly to the emergency room. So it's really important. We have provided education to hospitals to call us, but we also really encourage veterans to know that in their families, so that just make sure somebody's calling it so that we can know that we're getting that they're in the hospital, and to try to cover those services. Helpful phone numbers. So our business office. So if you need anybody for the eligibility office, or Benny Travel, which is beneficiary travel, which is our way to get transportation for our veterans to appointments. This is the phone number. So that's our main line, that extension 2844. And then this is also the Office of Community Care, same main line, and then 5960. I'm going to hand it back to you because it is past 11 o'clock.
Okay.
And I got to go.
All right. Sounds good. All right. So vet centers. So vet centers are a really great option for readjustment counseling and counseling services. So talking about anybody who might want to be seen for some mental health counseling and not want to come to a VA medical center, vet centers are a really great option. So we throw this slide in there just to remind people that vet centers are technically part of VA, but very different, right? Our systems don't talk to one another. So a lot of times there are veterans who would like to have a different kind of level of kind of confidentiality, it might be, for various reasons, and they don't want that record to intermingle with their medical record. And so it's a really great option. So we like to just have this in there and remind that this is a great option. So here in our area, these are the vet centers that are listed, and they have a great crisis line as well. So that information is down there. So that's just a little reminder. So that rounds out the services piece. So we just have a couple things here at the tail end to share about the benefits. So this slide again brings us back as a reminder. That was all VA Health Administration, that one in the middle. So this next piece is Veterans Benefit Administration. Okay. So the VBA, we call it VBA, Veterans Benefits Administration, manages anything to do with like the money. I just kind of say the money side of things. So that could be compensation, could be pension, could be the home loan program, could be what we call VR&E, which is that's the bottom one here. That's assisting service members and veterans with service-connected disabilities to obtain, maintain suitable employment, start a business, or receive independent living services. So that's kind of an overview. There's survivor benefits. There's a lot more that VBA does than just this little snapshot. These are kind of the most common ones that we get asked about routinely. So take a closer look at these. Service connection. We've mentioned that quite a few times in talking about these services. So to just explain a little bit more what that is. Service connection drives quite a bit in the VA. So a service connection is a percentage. Okay, so if a veteran or someone who's been in the military is injured or has an illness related to their service, they can submit a claim saying, I have this injury or illness related to my service. I'd like it reviewed. It goes through a process where the VBA requests an exam, some evidence. It's reviewed by a board. If the VBA determines, yep, this looks like it meets for service connection, they'll give it a rating, anywhere from 0 to 100%, depending on some multiple factors. It could be whether how much it's impacting somebody's ability to function. Some of them have a set service connection where if you have it, this is your rating, and it is kind of what it is. So they give a rating, 0 to 100%. And then that goes to the veteran. You can have a service connection for multiple things. So I could be service connected for sleep apnea and PTSD. I could be service connected for a laundry list of things. And then it goes into VA math, where it's all weighted differently and it's figured out differently. And VBA goes through and does this. So if you were to add something up, all the 10s and 20s and 30s and 70s, it might look like it's more than 100%, but we just, somebody's 100% service connected. All right, so that is service connection, and it talks a little bit about if you're going to help somebody or recommend or suggest, or somebody asks you about applying for service connection, just gives you a little bit of information on an application. We get a lot of questions about aid in attendance. So aid in attendance is a VBA benefit. You can get aid in attendance for pension and compensation or service connection. They're called two different things. You can see at the bottom here, special compensation is aid in attendance for a service connected veteran. So you're really asking for aid in attendance for someone who gets pension. So a pension, you can get a VA pension if you're not service connected. And that's a whole other set of criteria. Right? I told you this is going to be a lot of information. It gets confusing. So VBA's got its whole other set of things that we could spend a lot of time on too. So, but aid in attendance is this really excellent benefit that I encourage a lot of people. We talked about these, kind of geriatrics and extended care benefits and aging population benefits. And this is a really good one to help increase somebody's income if they need it. So it's a homebound benefit for somebody who is in need of assistance of another person. So something to consider. Really quick, how you file a claim. So if somebody wants to file for service connection, pension, aid in attendance, this is the way to do it. So it can be done online. Any VSO can do it. So there's a few listed here, but there's lots and lots of VSOs, right? And then here in New Hampshire, we have a regional office in Manchester that you can do directly through the VBA, but there's lots of VBA offices throughout the country. So here's your takeaways, okay? The VA has a lot of programs, a lot of benefits. VAs may vary a little bit in terms of type of program, like the vet directed program that Sarah mentioned is not at all VAs. Medical foster home is not all VAs yet. So the best recommendation I can give is to check in with a local VA. If you're here in New Hampshire, that's us, you know us now. Let us know when you have questions about a specific situation and we can kind of help guide you. If you're not in New Hampshire, get to know your local VA because that's the best way to figure out what the specific situation or best service for the veteran that you're working with is. Eligibility can be complex. So again, specific veteran situations are best to manage. Some of those might be really cookie cutter and you can look at that list of eligibility to see, you know, yep, somebody served before 1980, it's going to be 90 consecutive days. They had an honorable discharge. They've got, you know, minimal income. Yep, seems pretty clear cut. Just go ahead. Why don't you just go and submit an application and, you know, it's not going to be too difficult, but most cases take some looking at to try and see how somebody's eligible. I always recommend for people to apply now. I say this all the time to veterans and individuals who are currently serving in the military or just getting out, I would say, of the military, because if you wait until you need it, it's often challenging, right? Because then the first question is, where's your DD-214? I haven't seen that thing in 20 years, right? So trying to dig that out of the pile of papers can be a challenge. And there are some eligibilities, right? I didn't get into it in this presentation, but there's a 5-year eligibility from separation from combat theater operations. So there even is eligibility that you can miss a window for. So don't wait, apply now, because once you're enrolled, you're always enrolled. So encourage people to do it. You don't have to use it more than maybe going to a primary care visit every couple of years to keep your information in the system. You can go to, you know, as much as you need or little, just once you're enrolled, you're always enrolled. Talk to your local VA. And that's it. So I know we had a couple questions, but if there's others, I'm happy to hang around. I know we're over, but I'm happy to hang around if people have questions. That's it.
A question.
Yeah.
If someone's enrolled in the VA, and they're functioning well,
Mhm.
and then as they age, they start to decline.
Yeah.
And they're not aware of all of these, you know, things. Do veterans that are already enrolled and have been for years have like a case manager that they can reach out to? And there are lots of times that when we work with patients at the hospital and they're in their 70s, 80s, or sometimes even 90s and don't have the ability to go online and apply here or have family to kind of help support them with that. So what do you recommend someone who is of that population? The two-part, I guess. Do they have a case manager that they can like contact regularly? And what would you recommend to do that who struggles with stuff like that?
With online stuff, sure. So the question is there a resource for case management for somebody who's been enrolled in the VA for long term, was the first part. And so yes, there definitely is. So every primary care team has social work, and often a lot of them have nurse case management connected to them. So here in Manchester, we have both. So we have nurse case management and we have social work, primary care social workers connected to every primary care team. So every veteran is enrolled with a primary care team. So they may not have ever spoken to either of those two people, but as stuff is coming up, if they tell their primary care doctor or a family member says something to their primary care doctor or just primary care doctor notices it, they can put in a consult for that service and the social worker or nurse case manager will contact them and help them. And the second part of that question kind of rolls into that same answer. So the second part is if somebody's not really computer savvy, how do they access or get some of this information? So that person acts in that same role. So all of our social work case managers and our nurse case managers have this information and they're trained in this information. So they're going to be able to provide this information for somebody who can't go search it. You know, even any of us who might try to go online and try to find this information. I was just talking with somebody from a VNA locally yesterday who's like, well, I went online and tried to find some information. Even us trying to do it can be confusing because, you know, it looks like this person might be eligible, but, you know, if you read one little sentence wrong, or you think that means this and not that, you may have a completely different understanding. So those social workers and nurse case managers are really key and they can help walk through any of that. So the VAs have them.
I have a couple of questions
Sure.
online. First is, if not located in New Hampshire, can we call the numbers given to obtain a local contact?
Yeah, so I, as chief of social work in New Hampshire, have a list of all the chiefs across the country, so I can absolutely get you a counterpart in any state. I actually, before this role, worked in other, you know, frontline staff roles as well, so I can often find you a good person. So feel free to reach out to me.
And then another question, what percentage of service connection allows a veteran to be eligible for VA nursing home or long-term care? And can spouses of veterans be eligible for the same long-term care benefit?
So long-term care, so for our contracted nursing home, generally 70% and higher. However, there are some rules around 60% and higher. So that's why when Sarah was saying if somebody's close to 70%, you should check with your local VA because there are some rules around that and some recent rule changes actually to include 60%. So 70 has been the rule. 60 is now kind of a piece of the puzzle. For contracted nursing home placement and payment, it's only for the veteran. So unfortunately, we cannot pay for spouses of veterans unless they served as well, and we can get them eligible and enrolled. So that is just for veterans at this time. Medical foster home is a really cool program. That is one that does I have seen spouses move in with veterans in medical foster homes. I've seen them bring their pets. They don't want to go to a nursing home because, oh, you know, my dog can't come with me. So that's a really cool, unique program that does allow for some of those unique situations. But medical foster home right now is veteran paid. So the veteran pays for that program themselves, which we help increase their income usually to do that. But yeah.
Where are the medical foster homes? Are they assisted living?
No, so medical foster. So this question in the room was, where are the medical foster homes and are they assisted living facilities? So they are not assisted living facilities. Medical foster homes are homes like yours and mine that we own, and they invite veterans to live in them. Can be any foster home can have up to 3 veterans in their home. Doesn't have to be 3, it can be 1, could be 2, whatever. But New Hampshire, we don't have any just yet. We hired recently a program coordinator to restart this program. We had it maybe 6-7 years ago, and we stopped it because we didn't have good traction at the time, but we're restarting it and we're pretty excited. So anybody who wants or knows somebody who might want to be a foster home, let me know. But other areas of the country, it's been very, very successful. Massachusetts has some, Maine has some, Vermont has some. I started the program in Miami. I had a wait list of homes. So they're anywhere in the community, just New Hampshire, we're working on it.
But Kristin,
Go ahead.
in regards to that, can I ask, so I think you said that the veteran, you would up their income. And is that just a relationship with the individual that owns the home? Do they get like paid? Like how does that work? Or is it
Yes.
just they're accepting?
Sure. So the question is kind of what is the financial relationship in a medical foster home? So the financial agreement is between the veteran and the homeowner with kind of the support of the VA. So there's a range. It's generally between about $1,400 and $3,000 a month that the veteran pays. It's dependent on how much care they need. So we kind of help to negotiate that price with the veteran and caregiver. If the veteran has and wants to use that money, say it's kind of, based on whatever assessment, and they say, yep, $2,000 sounds good. This is what we're going to provide for that. Everybody seems happy. That's what we set. The veteran says, I have that. I have more than that. I'm good. Then all is good. But if the veteran has $1,000 a month and they say, I really want to do this. So the VA then would step in and say, okay, what can we do to try to increase this income? So oftentimes we'll try to apply for aid and attendance if they apply, because needing a medical foster home essentially meets those criteria of aid and attendance. We can expedite an aid and attendance application, get them a bump up in their income, which then could help support them to pay that caregiver.
So it's intended that the services that the veteran needs would be provided by them,
Yes,
not with the VA.
that's correct. So the homeowner provides the day-to-day stuff, but then the VA does do home-based primary care. So that was one of the slides. Home-based primary care comes in and does support. So they're helping to fill like pillboxes, and so you have that support coming in, so they're not just trying to figure it out on their own. Yeah.
And the benefits that you talked about, are they basically nationwide? The programs may vary, but the benefits for the veterans are available for all
Yeah.
veterans regardless of where they live, correct?
Correct. Yeah. So that medical benefits package, that is uniform to everybody. The service connection, pension, aid and attendance, that is uniform to everyone. So, and a lot of the programs are uniform too across the country. So adult day healthcare, home health aid, community nursing home, CLC, all of those are everywhere. But sometimes the differences are the eligibility is slightly different at certain places. Vet directed is one that might not be everywhere. Medical foster home might not be everywhere. But I think all of the others are offered everywhere. Just kind of running through my head the ones we had on there.
Questions?
One more quick one. Sorry.
Yeah.
Is even attendance, financial compensation given to the veteran, and then they do what they want to provide caregiver? Is that separate from like having a caregiver in another program?
Yeah.
It's just financial related to that.
So the question was, is aid and attendance a financial benefit, that money that goes to the veteran and they can do what they want to pay with that money? And the answer is yes. So if a veteran is approved for aid and attendance, they pay whatever care they want to or need to with that money. So if you are approved and eligible to get aid and attendance, yeah, you can pay for home health aid. You could pay for medical foster home. You could pay for an assisted living facility. A lot of assisted living facilities kind of do this routinely with veterans that move in. So
Is there an average stipend for that, or does that vary?
there is a maximum that I don't know off the top of my head for aid and attendance. So there is a maximum. Is it?
So,
Yeah.
yeah, I applied for my father last year who was going into assisted living, and I think he got the max, which was $2,700 a month, somewhere around there. So, and that goes into the trust that we set up for him, and then we pay for the assisted living out of the trust. So, yeah. And here's some advice. If you're going to apply for aid and attendance, we used a private vendor to do it for us, because it is an incredibly involved process. And if you can just find all the documents, send them to your vendor, they will do all of the paperwork, and they have like an 85 or 90% first time approval rate. Whereas if you do it individually, I think that drops to about 30%. And you get rejected, they want more information, and it can go on for months and months. But we had it done within 3 or 4 months, and it was well worth the money that we paid for it. So, yeah. Any other questions? I don't have one more here from. Nope, no more from online. So
Okay.
thank you to Kristin
Yeah,
and Sarah
my
for our
pleasure.
presentation today.